Let me explain something to the audience. Take a look at this needle I'm using here. This specific needle is the thinnest needle available on the market. You will often see many other colleagues and clinics using this one over here instead. This particular one right here is only for when it has already fully taken effect and is working, just to have a much higher flow. Because if you start with this one at the very beginning, so if you see any other video from someone else doing the same thing in their own tutorial, this specific area is quite sensitive and tends to hurt. When they begin the anesthesia process with the yellow needle, you will feel a sting that hurts, but the pink one is much more comfortable and doesn't hurt at all. So you might ask yourself, why doesn't everyone just use pink? Well, there are 3 reasons for that. Actually, let's say for 2 reasons. No, definitely 3 reasons. First, they simply haven't even thought of it yet. And second, the truth is they just don't really care. They say, okay, it's going to hurt and that's that. Third, this specific needle, which comes in boxes of 100, costs 5. It costs many times more than the next smaller size. Meaning for this specific one here, a pack of 100 individual needles might cost you 10 euros, but for this larger one here, they cost about 60 euros in total. Also, another very important feature to consider is this special integrated vibration device. It's hardly a secret. It is something that any colleague can easily find if they truly want to demonstrate the concern I show for my patients not to feel any pain. It's a specialized vibration therapy device, which I go into great detail about in my book. And it is incredibly effective and helpful in making the pain almost completely unnoticeable. Why is that? Let me take this off for a moment. Why? Because the complex network of nerve fibers that transmit the sensation of pain, these are exactly the same as the nerve fibers that transmit vibration signals. So, when you have already occupied that specific fiber, which acts like a common wire with a vibration sensation first, this wire will naturally transmit much less of the actual pain sensation to the brain. Conversely, if you have already started with something painful and then apply vibration afterward, it will prefer to continue. It will send the pain first and then less of the vibration. So this is a clever psychological trick to fool your mind so it no longer feels the sensation of physical pain. Now that it's already worked enough, we can go in with a thicker needle and see how he feels. Do you feel it?
I don't feel it now.
He'll feel none.
I can clearly hear you now.
Well, that is good. So, dear colleagues, this is when the yellow one should be used. Actually, it's not from the very beginning.